Okay, good afternoon, everybody. On behalf of Adrod Biomed, I welcome you all to this webinar on immunity and glutathione. In fact, we know that in the current situation that we are in of very crisis, we are looking at several factors. And one of the things that has been at the center of discussion is basically about immunity. We are discussing about how do we really look at immune boosters, what is the role of immunity in preventing infections, what is the role of immunity and immune boosters that we are looking at in terms of probably in helping us to prevent any kind of diseases. We are looking at certain kind of immune boosters. We are looking at vitamins, we are looking at minerals. We also are concentrating on glutathione and other vitamins and minerals. So the current webinar is to look at what exactly is the implications of glutathione, what are the role of glutathione in immunity, what are the right dosages, what are the mechanistic ways why glutathione is actually called as a master immunity part of it. Why exactly is glutathione in terms of its mechanism of actions is going to be effective in several of these cases. And that's where we are going to discuss in next 1 hour. And we have a eminent panel here to begin with. And this panel consists of eminent scientists, eminent physicians, and international individual. So we have with us today Dr. Richie, who is there, Dr. John Richie, who's a professor of public health sciences and pharmacology at the Penn State University College of Medicine in Hershey. Dr. Rishi's research over the past 35 years has focused on elucidating the mechanistic links between the biological aging process and the development of age-related diseases and disorders. Using an interdisciplinary research, Dr. Rishi has been able to show a major aim has been on the role of oxidative stress generated during these kind of mechanisms. So I welcome Dr. Rishi here, and he has done an extensive research on, and he has got recent papers published here. The second panelist that I would like to introduce is Dr. Sadhana Sathaye. Dr. Sadhana Sathaye is an eminent professor of pharmacology at ICT Mumbai. She has a lot of research to her credit and has published several papers in international and Indian journals. Welcome, Dr. Sathaye. And then we have Dr. Farida Modi. She is basically an expert in dermatology and has done her postgraduate in dermatology. She's a practicing dermatologist and an aesthetic dermatology since past 20 years. Dr. Modi has her own clinic of Derma Care, where she is looking at the aesthetic dermatology and cosmetology part of that. So let's begin the session without any, any kind of delay. And this would be a kind of a question and answer session. We would be interviewing the panel, asking them a few questions related to this area. We would have Dr. Rishi also presenting a few of his studies which are there. So at the outset, Dr. Sathaye, let me just check with you and find out, considering your experience in the area of glutathione and the area of immunity, what has been your studies, what have been your research in terms of glutathione? Glutathione is called as a master antioxidant. So because I know I have been having several discussions with you. So would you like to throw some light on this and educate us in terms of the glutathione?
Yes.
And
so basically, my research is about degenerative disorders, and particularly Alzheimer's, Parkinson's, and even diabetes-related oxidative stress and the degeneration of retina or cataractogenesis, even in epilepsy, where the hippocampal area that gets degenerated, and then the role of glutathione, if glutathione could be helpful. I mean, if you could give some, I look at phytoconstituents which could increase the levels of glutathione and then see the differences or the recovery, attenuation of toxicants in such cases. And we have found that glutathione is an extremely important cellular protectant which can quench almost every radical, meaning reactive oxygen radical, reactive nitrogen radical, radicals on DNA, protein. Glutathione is capable of scavenging everything, and that's what it becomes very important molecule in the cellular system for that matter. And one of the most important things is that glutathione, along with P450s, which are almost present in all the cells, are capable of detoxifying most of the toxicants, meaning xenobiotics like pesticides, fertilizers that we could accidentally get exposed to. And this is my research about glutathione, and we have found that increasing levels of glutathione generally balances the degenerative processes. It reduces the degeneration for that matter.
So, madam, would you like to what to say talk about why glutathione is basically its advantages over some of the other kind of what to say antioxidants which are there? And if I look at it purely from a pharmacological perspective, what has been your findings from your research about glutathione as a molecule?
So, first, first I'll say about my studies. Then we'll see how the other vitamins and glutathione compare with each other. So regarding my studies, we have uh, explored the degeneration in the substantia nigra Parkinson's, hippocampal degeneration in case of Alzheimer's, or CA1 region in case of epilepsy, cataractogenesis in case of diabetes, or retinopathy in case of diabetes. Even immune modulation, we have seen that when the oxidative status is very good, cellular oxidative status is very good, then the degeneration is reduced, the immunity is better, and that's what we have seen. I mean, this is what our findings about glutathione. And uh, particularly in case of hepatotoxicity, literally the liver, when it gets intoxicated and glutathione gets depleted, there is definite degeneration in the liver, which can alleviate when you give antioxidants, other antioxidant which would scavenge the reactive radicals and restore the glutathione balance. So the minute the glutathione balance is restored, the organ starts functioning in a better manner. That's what is our finding. Now, about glutathione and other antioxidants as such. So vitamin C, if you can say, it competes with glutathione, and because that also can actually protect from any kind of radical damage like oxidative ROSs, reactive oxygen species, reactive nitrogen species, alkyl protein alkylations, lipid peroxyl radicals. Most of them, even vitamin C can do, but the unique property of glutathione that it can conjugate with P450s. It can, and it can help detoxify many of the xenobiotics like pesticides and fertilizers and many other toxicants that we are exposed to. This is very, very important because liver, along with many other organs like uh, kidneys, lungs, intestine, eyes, so many other organs also would have P450. Of course, liver being the maximum important organ. So glutathione is capable of this conjugation with P450 and detoxification of process and reducing the reactive radical attack on various organs and reducing the degeneration of that organ. And that's how glutathione is different from vitamin C. That is point number one. Now about why, in fact, you can give vitamin C to regenerate reduced form of glutathione or vice versa. I mean, ascorbate also could be regenerated if there is reduced form of glutathione. And then about vitamin E is not capable of scavenging the hydroxyl radicals. It is capable of scavenging the hydroperoxyl radicals, but not the hydroxyl radicals. So that's the difference in vitamin E and vitamin A. And vitamin A, there are conflicting reports in the sense that sometimes it even works as pro-oxidant rather than antioxidant, depending on the oxygen concentration. That's what there are conflicting reports about vitamin A, and that's how glutathione becomes definitely what you say master antioxidant, cellular master cellular antioxidant for that matter. It's different.
Yeah, thank you, madam, for stressing on the role of glutathione and putting forth the importance of glutathione as a natural antioxidant. And when I mean by natural oxidant, we know that glutathione is present in the body also on a routine basis. So that makes it also another important aspect of it. From here, I would like to go to the next our guest speaker, Dr. Rishi. John Richie, and invite him to make his presentation. Dr. John Richie has extensive research on glutathione and its role in certain immune cells. So in fact, some of his recent papers concentrate on the bioavailability of glutathione, which has been a topic of discussion, and its effect on the NK cells and the lymphocytes which are there. So may I invite Dr. John Richie to make his presentation and enlighten the audience about his research work. Dr. John Richie, please.
Yes, thank you so much for the introduction. Let me share my screen. Is my screen shared properly? Okay, great, thank you. It's a real pleasure to be here. Thank you for inviting me to participate with the other esteemed scientists on this panel. For the past 35 plus years, I've been involved in research on the role of oxidative stress in the aging process and aging-related diseases, with a particular focus on the role of glutathione in protecting against this oxidative stress. I'm going to share with you today just a few slides of some of the research that we've done over this time that I think is particularly pertinent to the topic of the webinar today. Just before I start, I would like to just give a short disclaimer. I'm not a paid consultant for any commercial company. However, I have received research funding in the past from Kyowa Hakko in Japan. So I just want to start quickly with oxidative stress. I know this is not a new topic for most of you, so I'll go through this quickly. But the term oxidative stress is a condition associated with increased oxidant exposure. And it occurs when oxidant exposures exceed the body's antioxidant defenses. So you can think of this as a balance, if you will, and oxidative stress can result from either increases in oxidant exposure or generation in the body, or from decreases in antioxidant protection mechanisms. And I want to stress that these oxidant exposures, for example, free radicals, which are especially potent form of oxidant, can result from either exogenous sources, such as pollutants or tobacco smoke, or can be produced endogenously in the body in the course of normal metabolism. The term oxidative stress is generally considered destructive in a cell, but I want to point out that that's only when there is an excess of oxidants, when there's an excess of oxidative stress. Actually, low amounts of oxidative stress are going on all the time in our cells, and it's the way our cells work. We respond to these oxidative stresses. But when this gets overwhelming, then that's when damage begins. The interest in oxidative stress stems from the fact that oxidants can attack and have negative consequences on just about every organ and tissue in the entire body. And it's involved in just about every disease and disorder that you can think of, particularly chronic diseases. And is even thought to be a major cause of the biological aging process. So oxidative stress and oxidant exposures is extremely important for diseases, and determining the mechanisms by which this happens has been the subject of many research, much research over the past several decades. Now, as we've just heard, perhaps the major antioxidant that we have evolved to use to protect against oxidative stress is glutathione. Glutathione is a tripeptide, small protein with 3 amino acids, glutamic acid, cysteine, and glycine. They're put together in a peculiar way, so it's a gamma peptide linkage with the glutamic acid, which causes it to be stable in our body and in our cells. It's actually discovered by Sir Garland Hopkins back in 1921, so nearly 100 years ago. And it's for this work in part, he had won the Nobel Prize in 1929. It is the most abundant antioxidants in all living tissues. It's the major endogenous antioxidant, and I put the word system here, and this is important because unlike most dietary antioxidants that you will hear people talk about, glutathione is actually an antioxidant as well as a series of enzymes which are critical for its regeneration in the body. So it's really an antioxidant system that we've evolved. And one of the other important features of glutathione is that many antioxidants, when they do their job as an antioxidant, they become oxidants themselves, and they become a problem themselves, and that problem has to be dealt with. In the case of glutathione, the oxidized form, which is the glutathione disulfide, is considered a safe form, and one of the reasons why it's safe is because there are enzymes in the body which reduce it right back to glutathione again. Now, the thing I want to stress here is that glutathione is well known as sort of the as an antioxidant, but it also has many other critical jobs within the body. As we heard just before, it's involved in the detoxification of a whole series of xenobiotics and drugs. It protects protein structure and function. It's involved in maintaining immune function. It's involved in DNA repair, cell cycle redox regulation within the cell. And it has an important role in controlling many cell functions through a very intricate signaling mechanism. So glutathione is truly a multifunctional, ubiquitous molecule, and actually it is considered by many to be one of the most important small molecules in all of biology. I mentioned that it's involved in control of many cellular functions, and it does so by acting as an oxidant sensor. So when changes in a cell occur in redox status or during periods of oxidant exposures, the levels of the oxidized form of glutathione increase. The levels of the reduced form of glutathione decrease. And this in turn has effects on proteins in the body. These proteins can become glutathionelated. Glutathione can bind to these proteins. And this can also cause changes in the intramolecular disulfide bond formation in these proteins. And by changing these protein secondary structure and you can produce a series of signaling events that can trigger all sorts of changes in important cellular functions. And this whole process can be impacted by a variety of environmental factors such as diet or other exposures. It can be altered depending upon the cell type and the tissue type. And genetics and epigenetics can play an important role in terms of how this system works. But the important thing is that this is basically acting as an amplifier, where small changes in redox status or small levels of oxidant exposures can be amplified to cause large changes within a cell. And this is an important way in which our cells work and function. So we know that glutathione is very important. What happens when glutathione levels are depleted? Well, it turns out that glutathione depletion or deficiency states can occur quite readily. They can occur as a result of disease processes. For example, we know that in diabetes or in HIV, and as we've heard just before from the speaker before me, in neurodegenerative diseases, glutathione levels can be reduced. During very common conditions such as the aging process or periods of poor nutrition, glutathione levels can be depleted. We know that there are a whole variety of drugs and xenobiotics and oxidants that can reduce glutathione levels, such as acetaminophen or ethanol. We also know that glutathione depletion can occur quite commonly, even amongst healthy individuals. For example, we know there are diurnal fluctuations in certain tissues. Our liver levels of glutathione can decrease as much as 40 to 50%, even after just 6 hours of not eating. So each night as we're sleeping, our liver glutathione levels become depleted. And we know that there's quite a bit of genetic variation in glutathione levels, and I'm going to show you some results of work in my laboratory to demonstrate that. One of the areas that I mentioned before is the aging process, and we showed now many years ago, way back in the early 1990s, that a depletion of glutathione levels is a general feature of aging tissues. If you look in the mouse, for example, you can look at all of the different tissues in the mouse, and you see during the aging period of these animals, there's a precipitous drop-off in the levels of glutathione. And this decrease during aging also occurs in cells in humans. For example, showing here decreases with age in human lymphocyte glutathione levels. Now, it's important to recognize that glutathione is produced in the body. Most cells in the body have the capability of being able to biosynthesize glutathione. Even the red cell, which can't biosynthesize anything else, has the ability to make glutathione, to show you how important it is. And the way it's not made like most peptides or proteins in the body. It's not made on a ribosome, but it's actually put together from its constituent amino acids by a series of enzymes. The two enzymes that are most important for glutathione synthesis are glutamyl cysteine ligase, or GCL, which is a multi-subunit enzyme which puts the glutamic acid and cysteine together to form the gamma-glutamyl cysteine dipeptide. And then the glycine is added by the enzyme glutathione synthase. These are both ATP requiring enzymes, so it takes energy to make glutathione. This enzyme system, in particular, this GCL enzyme, is a very interesting enzyme complex. It is highly regulated in the body, its activity is thought to be, in most circumstances, rate limiting. We did a series of studies looking at genetic polymorphisms in the catalytic subunit of this enzyme, the GCL enzyme. And we found one particular polymorphism it's called the GAG77, is associated with decreased glutathione levels. If you look at individuals with the 7-7 genotype, you find that their GCL activity is lower and the levels of glutathione in their cells are lower. This happens to be in the lymphocytes. And what was most interesting is that when we did some epidemiologic investigations, we conducted some case control studies of lung cancer and oral cancer. We found that, in particular in smokers, that the risk for lung cancer and the risk for oral cancer in individuals with the 7-7 genotype were 2.5 to almost 4-fold higher than in individuals with the other common 9-9 genotype. So these results clearly demonstrate that polymorphisms associated with reduced glutathione production in cells are associated with great increases in risk of these two cancers, which are known to involve oxidative stresses. So we know that glutathione depletion is common, and we know that it's very detrimental. So a number of years ago, we began trying to figure out ways of correcting or preventing glutathione deficiency. There are a variety of ways that we and others have worked with to try to do this, by altering diet, by supplementing with other antioxidants to spare glutathione, and there are a variety of GSH precursor drugs or GSH inducing drugs. And all of these can work fairly well when glutathione levels are very depleted. But as glutathione, because most of these depend upon glutathione synthetic process within the cells, which is a feedback inhibited system, it's difficult to get very high levels of glutathione via these methods. And so we began to get interested in oral glutathione supplementation. And at the time, there was some controversy over whether, oral glutathione could be a bioavailable because of the fact that it might get degraded in the GI system in the stomach when it hits the very low pHs. However, there is a lot of literature to suggest that glutathione indeed can make it intact past the stomach and get absorbed and is bioavailable. We have done work, and there are many other studies in the literature which have shown in laboratory animal models that oral glutathione is quite effective at increasing tissue glutathione levels here. For example, there's some studies we have done in the rat. This is increasing, and these are 2-week feeding studies in rats, where we're showing dose-responsive increases in glutathione levels in various tissues in the rat after 2 weeks. And there are many examples of this in the literature. And as a matter of fact, there have been some very elegant studies done in Day's lab in Colorado, showing the pharmacokinetics of glutathione, oral glutathione administration in the mouse, showing increases in plasma, increases in other tissues, for example, in the lung. And actually, they've now determined that the protein which is responsible for the intestinal absorption and transport of glutathione into different tissues, in the mouse at least, is the cystic fibrosis protein. cystic fibrosis transmembrane conductance regulator. This is just showing some studies they did where they knocked it out and they no longer found absorption of glutathione in the plasma. So at least in the mouse, we know a lot about bioavailability of glutathione and the mechanisms by which this occurs. And there was even epidemiologic literature to support this. And this is some studies by Dean Jones's group down at Emory, where they looked at dietary glutathione intake and risk of oral and pharyngeal cancer. Again, these are oxidative stress-related cancers. And what they found using food frequency questionnaire data in large population studies is that the glutathione in the diet was related to plasma glutathione levels in individuals, but most importantly, in case control studies, they found that the risk for oral and pharyngeal cancers decreased in a dose-responsive manner with increasing dietary glutathione intake. And you can see that the levels of glutathione they were taking in, the differences ranged from down to the single digits in terms of milligrams per day up to 250 or so milligrams per day. So based upon these previous animal studies and the epidemiologic literature, we decided to conduct a clinical trial of oral glutathione. This was called the Glutathione Supplementation in Health, or the GSH study. This is a randomized, placebo-controlled, double-blinded clinical trial with 3 arms, a placebo arm, a low dose of glutathione a day, 250 milligrams per day, and this was based upon the previous epidemiologic literature. And then there was a high dose glutathione, 1 gram a day. And we decided to do a long-term study because that's what the results indicated. It's difficult in humans because of the very high turnover of glutathione in plasma to do your typical drug-related, drug-style, pharmacokinetic study. So what we really wanted to know is the longer-term impact of glutathione supplementation. And so this involved a 6-month study of supplementation with glutathione in multiple time points, and then a 1-month washout at the end. And we measured during this time course the levels of glutathione in different tissues and cells in the body, as well as some biomarkers of oxidative stress and immune function. And what we found was both in whole blood and in erythrocytes, we found a dose and time-dependent increase in the levels of glutathione throughout the course of the study. And not only were glutathione levels increased quite dramatically in erythrocytes, but also in other tissues and compartments. We found increases in plasma, we found increases in lymphocytes, and we found increases in exfoliated buccal mucosal cells from the mouth. We also looked at some biomarkers of oxidative stress, and one of the most commonly used biomarkers is the ratio of oxidized glutathione to reduced glutathione. In this case, we're looking at GSSG, which is glutathione disulfide, plus glutathione bound to proteins. These are the 2 major forms of oxidized glutathione. And what we can see is that we were getting decreases in a dose-responsive fashion in this ratio which is suggesting that the glutathione supplementation was reducing levels of oxidative stress in a systemic fashion in these individuals. As I mentioned, we also looked at some biomarkers of immune function. We looked at two specific types of immune functions, NK cell, natural killer cell cytotoxicity, using a standardized natural killer cell type cytotoxicity assay. And then we looked at lymphocyte proliferation after exposure to phytohemagglutinin. And in both of these, we found that the immune function was increased. In particular, the NK cell cytotoxicity was increased in the glutathione-treated groups compared to placebo groups. So, just to summarize, then, glutathione plays a critical role in protection against oxidative stress and related diseases and disorders. Glutathione levels can vary substantially from person to person. GSH depletion is very common in all of us. Oral glutathione supplementation seems to be an effective means of enhancing glutathione and thus protecting against oxidative stress-related diseases. Sorry for going through so quickly. These are materials which I could speak the entire day about, and so if I went on a little bit longer, I apologize. I'll be happy to answer any questions that anybody might have.
Yeah, thank you, Dr. John Rishi, for your excellent presentation and your thoughts on glutathione and the studies that you presented. At this point of time, I would like to welcome Dr. Girish Rajadhyaksha here to the panel. Thanks, Dr. Girish, for joining us. Dr. Girish is a head of department of medicine at BYL Nair Hospital, one of the premier hospitals in Mumbai, and at the forefront of the COVID fight. In fact, Dr. Girish Rajadhyaksha has been caught up with few emergencies, and therefore we are really great to have you. And we are looking towards your views on certain parameters. And before what to say, I go back to the other panelists. Welcome again, Dr. Girish. And one question that I would like to ask you at this point of time, we have discussed about a lot about glutathione. Dr. Rishi presented his data on that. Dr. Sadhana Sathaye talked about her experiences. But as a clinician and as a person who has been in the clinic, we would like to know your thoughts about immunity. What are your thoughts as a clinician about immunity? How does immunity basically help us in these current situations? And overall, your perspective about immunity as a clinician. Yeah, Dr. Girish. Dr. Girish, you're on mute.
Okay. Can you hear me?
Yeah, we can hear you now.
Yeah, there was some disturbance. Yeah. Sure. So, you want to ask me something?
Yeah. So what I said is that thank you very much for joining. I actually gave your introduction and I told the entire audience that you have been basically at the forefront of a lot of things that are happening and keeping us all safe. So thank you very much for joining the panel. As I said, we discussed a lot about certain antioxidants in the first part of it. What we are looking towards you is basically as a clinician, the entire role of immunity in humans and the role of immunity in disease. Your thoughts about it as a clinician and as being in a front line clinician in the current scenario.
The current scenario, Nair Hospital is a dedicated COVID hospital for last 4 months, and we have treated more than 7,000 severe to critical patients of COVID. We admit only patients who require oxygen. Now, with this brief information, as far as immunity is concerned, immunity is very important in any illness, for that matter, right from cancer to infectious diseases. As far as COVID is concerned, you see, in fact, immunity in two dimensions over here. One is who will get the mild disease, or those who will get say asymptomatic disease, and who will get more severe form of disease probably depends on the immunity of that particular person. So if your immunity is good, you may get very mild or trivial illness, and if your immunity is not so good, you may develop more severe illness. That is what we are saying. At the same time, this immunity on the other side can lead to excess response, and this excess response will cause lung injury, acute lung injury, and develop into the form of what is called ARDS, or acute respiratory distress syndrome. And once you develop this and large portion of the lung is involved, then it is very difficult to manage this particular patient. They require more and more oxygen. Their lungs stop functioning, so the gaseous exchange, it stops, and the patient develops hypoxemia, and the blood oxygen level goes down. Then multi-organ failure also may set in, and this leads to death of the patient. Now, many investigators have said that this is because of the immune response, which is more than required. So immunity plays double type of role over here. If you have got weaker immunity, you are likely to get more severe disease, like extremes of age, especially older patients, they get more severe type of illness. And other thing is, if your immunity is excessive, that excess immune response may lead to acute lung injury, causing death of the patient, or patient requiring ventilatory support, or remaining in the hospital for more than 3 to 4 weeks. So that is our observation in last 4 to 5 months as far as COVID patients and their immunity is concerned. Of course, diabetes is one infection, one illness which leads to maximum morbidity and mortality. And diabetes, as Sir also has said in his speech, is one of the causes where the glutathione levels are low. Okay, so it could be the reason. We have not done the study. I think we should do the study like that, whether in diabetic patient the glutathione levels are low. And glutathione, the diabetic patients, if they develop COVID infection, they are more likely to develop acute lung injury. That is what we have found. And the mortality also is more in patients of diabetes with COVID-19 infection. So these are my few observations related to your question.
Thanks, Girish. Excellent, excellent perspective, and I know it's going to really help the audience about it. I would like to now go to Dr. Farida Modi and just get her perspective about her what to say idea and her experience with glutathione as in cosmetic and skin conditions. So she has got, as I said, extensive experience in cosmetic aesthetics. So Dr. Modi, your thoughts on this?
Yeah, hi everyone. So of course, I'm getting my practical experience on glutathione. What I understand is glutathione is one molecule which is being used a lot and for a longer time in dermatology. So what I would like to get to the table is on the safety profile of glutathione. We have used glutathione as anti-inflammatory, as anti, as well as for its anti-melanogenic properties also. We have known, of course, glutathione is one of the master antioxidant, and many of the skin conditions are related to the ROS produced on it. So I personally have used this molecule for aesthetic purpose, like for anti-aging, which improves the tone texture, the elasticity of the skin. What I would like to let the audience know that I've used glutathione continuously on a higher dose of 1000 mg per day for a good 6 months, taken into a lower dose without any side effects. Also, I've used it for conditions like LPP. LPP is lichen planus pigmentosa, which actually again is a melanogenic condition, along with a lot of inflammation which happens on the skin. And we've seen some very good results just with oral glutathione and topical vitamin C. So when we're using just pure antioxidant, oral antioxidant as well as topical antioxidant, we've seen wonderful results in cases like LPP, even for cases like melasma, where again inflammation and melanogenic activities plays a huge role. We have glutathione and we've been using it from the last 4 to 5 years with good results in these conditions. Overall, again, for various kind of rejuvenatory effect and for cell regeneration, glutathione has given us excellent results in our aesthetic practice. So that's my personal experience, of course, with glutathione.
Okay, thank you. So I would like to ask one question to Dr. John Richie, is that you have done a lot of studies and you have extensive research. Any what to say research or any papers that you have come regarding use of glutathione in viral infections that have been there, whether it's Ebola or whether it is H1N1 or any of the other or maybe HIV. So any experiences or thoughts on that?
Yeah, so we've not done a lot, and to my knowledge, there's not a lot of studies in the literature, except for a couple of studies in HIV, and these were somewhat limited studies looking at glutathione, oral glutathione. In HIV infected individuals with fairly severe AIDS symptoms, and there has been some limited success with this glutathione treatment, but it was never really followed up on adequately with sort of more complex, with larger studies in individuals earlier on in the disease continuum.
Thank you so much.
Yeah.
Dr. Girish, I would like to ask you another question related to your earlier question. Is you talked about diabetes and some of the observations that you have had. But what's the role of immunity in terms of looking at different kinds of other comorbidities, age, the effect of age on immunity? So your thoughts on that in terms of your clinical experience?
As far as age is concerned, the immunity changes as per your age advances. It goes on decreasing, and you get lot of problems, health related hazards because of your decreased immunity, and you are likely to get more and more infections. For example, if you see the older patients, they're more, see, viral infection like influenza, which is so common. But if you see older patients above 65 or 70, they are more likely to get more severe type of influenza infection leading to pneumonias. And once they develop pneumonia, that pneumonia of simple influenza becomes very, very bad. And it is very difficult to treat these patients because they go into respiratory failure very easily. So this is one example. That, influenza vaccine to these patients. Why? Because we are not sure of their immune response. So age is very important. As I said, secondly, the diabetes, various cancers, HIV, we have neutropenic patient, but that is a different type of immune problem. So there are various conditions which lead to decrease in the immunity. Now, I would like to know more about glutathione because I personally have not done any study related to glutathione. I just heard about it. So glutathione in these various conditions, right from aging to diabetes, especially because I'm more interested in diabetes. There's a huge population which is diabetic. The other huge population which we are seeing otherwise non-COVID days is geriatric population. So I would like to do personally the study of this glutathione levels and its effect on geriatric population, one, and number two, diabetic population. Third, we have a large number of HIV patients also. We have ART clinic with more than 10,000 patients regularly coming who are HIV positive. So that is another big group where I think we should do the studies to know what is the glutathione level and whether glutathione replacement orally how Dr. John Richie has beautifully explained to us just now. So if, with this particular study, we can help them by glutathione replacement. That is what I feel. At least these three big populations: geriatric, diabetic, and HIV. Cancer population is other thing. We have a large number of cancer patients also if you want to do the study.
Yeah, sorry. Dr. Sadhana, would you like to elaborate on what Dr. Girish said? Because you have extensive experience with doing certain studies on glutathione. So he, I think, raised very pertinent questions. So any thoughts on that?
Yes, particularly when you talk of diabetes, there is a tremendous reactive oxygen damage. And therefore, the balance of GSH generally gets to GSSG. And when such things happen, the cellular signaling pathways, they get stimulated. And stimulated in the sense that the proliferation of the cells, that reduces and the apoptosis increases. And this is the reason for problems with degeneration in case of diabetes. So reactive oxygen damage is one of the major causes in case of diabetes that changes the balance of reduced glutathione to oxidized glutathione for that matter. So that's well known because even proteins get oxidized when diabetes happens because they get rearranged in the form of Schiff's base and then methyl galactose. All of them individually can produce reactive radicals, and glutathione being one of the important cellular antioxidant, it would just go scavenge and then the balance would shift to GSH to GSSG. So, it would outpace the synthesis, meaning synthesis wouldn't be as much as the conversion of GSH to GSSG is there. And that would stimulate all kinds of cellular signaling pathways. That would lead to reduced proliferation of cells, increased degeneration of the cells that way. So
Thank you, Doctor.
100% GSH would help, I'm sure. I mean, we should try that.
Yeah, so thanks. I think that's a great response. And I think I take your point, Dr. Girish, that we need to have certain clinical data generated in these populations. That's a very important thing, as you said. Dr. Rishi, we have one question from the group. And when you presented your data regarding the NK cells and the lymphocytes and the effect of glutathione, can we what to say comment on the immune boosting activity of glutathione based on this data?
So let me just start out by saying that I'm not an immunologist. Luckily, I had some very good collaborators on this research, and the individuals that we had in this study were all healthy, non-smokers. So they were not experiencing great amounts of oxidative stress. They were basically middle-aged individuals. There were very few elderly people in this study. So the overall, the general levels of glutathione of oxidative stress were pretty low in these folks. Their glutathione levels were typically fairly high, and we did this on purpose because we wanted to set up a system where we were able to go in even amongst healthy people to see if we could boost their glutathione levels. And we were successful in doing that. Now, as I mentioned, these folks were not experiencing tremendous amounts of immune dysfunction, but yet we were still able to see these changes, enhanced ability for lymphocytes to respond to a stimulus and to proliferate, and the enhanced ability of NK cells to destroy foreign cells. Now, these are simply assays that are typically done to assess certain aspects of immune response in people. they're not necessarily examples of all of, I mean, immune function is very complex, and they're just looking at two specific kinds of functions. And, you know, there's debate as to exactly what that indicates, what these simple assays indicate regarding the overall immune status of an individual. But they do suggest that we're moving things in the right direction. And my guess is that once we move into a diseased population, an elderly population, a more highly exposed population, such as in smokers, we would see much greater differences, much greater effects on all of these markers, including these immune function markers. And I just want to end by saying that, you know, I very much appreciate the comments of Dr. Girish regarding the need for doing clinical trials in diseased populations. I think that our studies and those of others clearly indicate that these studies desperately need to be done, and I'd love to see them get done.
Sure. Thanks. Dr. Farida, I think you are probably one of the clinicians who has got extensive experience with glutathione. So I think you alluded to this part in terms of the combinations that you use, but I would like to ask a very specific question regarding the kind of combinations that you use with glutathione and your dosages and durations that you use in terms of the overall safety of the molecule. So if you could just elaborate on that.
So typically, you know, glutathione we use alpha lipoic acid and vitamin C orally. And in many conditions, we also, since we have topical vitamin C serums available, we combine it with topical antioxidants. There are glutathione available even in topical form, but in our practical experience, we've not seen any results with topical glutathione per se. So glutathione is available in dermatology in topical form, in spray form, oral form. We also have tried giving glutathione as a mesotherapy where we inject it directly. And out of like formulation, what we think is what works best is oral glutathione. Typically, we started with a higher dose for 3 months to 6 months till we see clinical improvement. And then we move to a 500 mg OD dose as a maintenance. And we would continue it for 6 months to 12 months and then probably have a pulse dose of other antioxidant bringing.
Okay, thank you. Thank you very much. Girish, one question that I would like to address to you is that when we talk about immunity, what is your view as a clinician in terms of the minerals and the nutrients that are being talked these days? Because I personally, when I saw a lot of literature, there have been certain Cochrane reviews about certain vitamins and minerals in this area. So any thoughts and any, what to say, opinion that you have on this in terms of the immunity aspect?
The immunity, there are various things which are described, but the thing is, unless we have the study, because we have also we are giving vitamin C. Vitamin C in a big way. Even in COVID, we are giving vitamin C. Initially, used to give injections also of vitamin C of these patients. We have found that there's hardly much difference in the outcome after giving this. But vitamin C was definitely described in immunity of the patient, and that's why citrus fruits and various fruits like amla, okay, then lemon, limes, etc., are being discussed, that we have to give these particular things to the patients or to general population to boost the immunity. So vitamin C is definitely more important. Glutathione also we have heard, but we have tried in very few patients actually. To be frank, only 1 or 2 patients I could give glutathione. Both the patients did very well. But whether they did well because of glutathione or they did well because of their other medications which were given, it is very difficult to say. But in this particular thing, immunity has come into forefront, okay, and limelight, I would say, as far as the management of various diseases is concerned, especially the COVID.
Thanks, Girish. I think that is what we wanted, a clinician's perspective, because as we all know, You have been at the forefront of everything, and you have the practical experience, and your views are very, very valuable. Dr. Sathaye, one question that I would like to ask you is in terms of what is the current situation in terms of glutathione, in terms of some of the clinical studies that you may have come across, and the safety of glutathione over a period of time, and what is the future that you look at it? One of the futures Dr. Girish mentioned, and Dr. Richie also elaborated, that we need to have certain clinical studies. So in your perspective as a pharmacologist, what do you think is the current literature in terms of the clinical efficacy, safety, and what do we see the future for glutathione?
Yeah. Sorry for that. So there are a few reports, recent publications that have been seen. So one of them is from Italy, and it is published in July 2020, which is taking an account of various different clinical studies with N-acetylcysteine administration, about 349 of them completed, and glutathione administration, which about 100 of the studies have been completed. And in both these studies, they say that higher doses of glutathione are capable of inhibiting the COVID-19 disease, COVID-19 situation, I mean the viral infection for that matter. And then there is another report wherein, 1 minute, I have got some few studies. Okay, so they have mentioned that there is one report which says that deficiency of endogenous glutathione in particularly diseases like diabetes, cancer, cardiovascular disorder, respiratory disorder, the glutathione deficiency leads to acute exacerbations, meaning they have reported about this. This is a study from Russia. So they have reported that endogenous deficiency of glutathione has produced acute exacerbations of COVID-19, meaning ARDS, respiratory distress. And then one study in New York, very recently, April 20, they have published that two patients with COVID-19, they were given about 2 grams of glutathione for oral, or even IV they were given in both the patients, and both of them, it was effective in relieving the respiratory symptoms. So there are a few reports wherein people are, I mean, reporting that administering glutathione even in the dose of 2000 milligrams per day is capable of reducing the ARDS kind of symptoms. So that was one. And what was the second question that you
in terms of
asked
the
about?
future prospects?
Yeah, and about the toxicity and metabolism of glutathione, I also see one of the questions here in this question answer session. So, in one of the reports, they have said that uh, amount of glutathione in the body is about 30 grams, human body. Considering it, it's like glucose and it's like ATPs. Like glucose is 5 millimolar, glutathione is 2.5 millimolars. So about 750 milligrams per liter is the glutathione concentration. So overall, it would be 30 grams of glutathione in the human body. And they have mentioned that reported that the half-life is about 48 hours. So 2 days, if you consider, then the total glutathione would get out, supposing 30 grams is there, would get out of the body within 5 days. I mean, within 10 days, 5 half-lives. So 10 days. So meaning every day 3 grams of glutathione would be utilized, I mean, would get excreted out of the body. But most of the glutathione is always recycled. It gets to GSSG, and then because of the different enzymes, gets back to GSH. So generally glutathione is recycled. It is also synthesized because of the dietary proteins that we uh, intake. But it is very difficult if there is a serious depletion, like in case of old age or like in case of diabetes where there is an oxidative damage. So in such cases, it is important to give glutathione supplementations. So I'll just give you, because I have been currently suffering from an inflammatory disorder, and I have started taking glutathione, and it's really making wonders to me. It's increasing the energy level, and I can feel the mobility has increased because of the inflammation that had gone down. So glutathione, I see future, and yeah, but we have to even think of how absorbable it is, meaning all those studies would be needed today.
Thank you, madam.
Availability.
Yeah. Thank you, madam. So the last question I would probably like to address to Dr. Richie is, considering this based on your clinical studies that you have done, what are your views in terms of the glutathione usage? How do we use it in combination, single, and again, in terms of again any comments on the safety part of it, and of course, most importantly, the bioavailability part of it, what you did. So some final parting comments on that.
Yes, certainly. So first of all, just regarding the safety, that's one of the beauties of glutathione, is that there's no toxicity that has been associated with oral glutathione intake, and so from that perspective, it's very safe, and there's been reports in the literature of cases of very high levels of intake without any issues. But to get to your main question, I mean, I think there's a tremendous future for glutathione, which is really interesting because it's a very old molecule. A Nobel Prize was won on it nearly 100 years ago, and yet to this day, we're still learning new things about its importance in both normal health conditions and in abnormal disease conditions. I think the new studies and results that Dr. Sakura mentioned regarding some beneficial effects that have been noted for glutathione in COVID are fascinating. I think that as clinical trials are done, I think we're going to find that glutathione is going to have a critical role in the treatment of all sorts of disorders, from diabetes to long-term neurodegenerative diseases, to inflammatory disorders, to acute infections. And in some cases, I think that glutathione in combination with other drugs will be something that I think will be quite useful. Because I mean, glutathione will set the stage for the other drugs to work effectively. And also, in the case of certain diseases, for example, cancer, where many of the cancer drugs are quite detrimental to the body, the glutathione can act as an adjuvant to protect the healthy cells and to keep individuals healthy as they're going through their disease treatment. So I think the upside for glutathione is very high, but it's going to take more research and well conducted, well controlled clinical trials.
Thank you, Dr. Rishi. Now, I'll just like to have final comments from a couple of participants. So, Dr. Farida, any final comments on what I think Dr. Sathaye spoke or Dr. Rishi spoke from your point of view in terms of glutathione, and how do we really look at this in the coming times?
Yes, this molecule, to me is a very exciting molecule in medicine, not only for dermatology. In dermatology, we've used it for inflammatory disorder as well as for aesthetic. But I'd like to share one experience I had with this molecule. I have this one patient from Dubai, UAE, and she got some test called as oxidative stress level test, which a naturopathist there, a naturopathic physician had done, and she'd seen low levels of glutathione. So she sent her to my clinic, since we also in our clinic use this IV glutathione. So, IV glutathione is available in 600 mg. We used around 1200 mg twice daily, and in 4 weeks, her oxidative stress levels had reduced and her symptoms got better. We were also excited, though that we didn't promise her anything. But this molecule seems to be a very interesting, fascinating molecule, and we must study in our medical condition.
Yeah, thank you, Dr. Farida. So, Dr. Girish, last comments from you as a clinician in terms of the immunity and the current scenario, and how do we really look at immunity in the future, and in terms of mineral and vitamin supplementations, your final comments on this.
I think nutrition and immunity are very important in your health as well as in your disease. And as far as glutathione is concerned, I think it is very, very exciting. We have to do studies so that more and more patients can be benefited. We have to see whether the glutathione levels are really low in various age groups, then in patients of diabetes, HIV, and cancer, and some other chronic illnesses like collagen vascular diseases, rheumatological diseases, etc. So these are the conditions which are important, and here we don't have really good treatment as such. So if glutathione, what Dr. Sadhana just now said, she is suffering probably from some chronic inflammatory disease, and glutathione made wonders, miracles. So we have large number of such patients. If you can do study that to show that first of all their glutathione levels are low, number one, and number two, by replacing, by doing glutathione replacement, if the level improves, and one is the level improves, and the secondly the symptoms also improve, and the course of the disease also improves. In that case, it will be really a wonder drug. So I think we have to think of this as far as the future is concerned.
Thanks, Dr. Girish. So finally, I would like to conclude by thanking all the panelists, Dr. John Rishi, Dr. Girish, Dr. Sadhana, and Dr. Farida. I would also like to thank the audience for raising interesting questions, which really made this discussion very, very absorbing and exciting. So finally, I would like to say is that thank you very much. Immunity, as doctor and all the other panelists mentioned, is a very, very important aspect and a very, very important parameter. Nutritional and nutritional supplements are quite important into it. We look at any of these, there's a lot of literature and data coming onto it in terms of the immune boosters. And what we need is, we need future data. We need clinical studies, which would really help us to say that these things really work. So thank you very much once again, and good evening. Thanks. Bye.
Thank you so much.
Thank you.
Thank you. Thank you.
Thank you, Anish.
Thanks.